Our kidneys are vital organs, and their optimum function is important for a healthy life. Due to various reasons, many people develop kidney issues like stones. This is a common and often painful condition that can have serious health consequences if left untreated. Understanding the types, causes, and symptoms of kidney stones is crucial for prevention and early intervention. This video will provide comprehensive insights into what kidney stones are, the factors that contribute to their formation, and the potential complications they can cause. So, stay tuned until the end because knowing this about kidney stones can save your life. First, let's understand what exactly kidney stones are. Introduction to kidney stones. Kidney stones, or renal calculi, are hard deposits made of minerals and salts that form inside your kidneys. They can vary in size from a grain of sand to a golf ball and can cause severe pain as they pass through the urinary tract. Kidney stones form when your urine contains more crystal-forming substances, such as calcium, oxalate, and uric acid, than the fluid in your urine can dilute. At the same time, your urine may lack substances that prevent crystals from sticking together, creating an ideal environment for kidney stones to form. The pain from kidney stones, often described as one of the most severe forms of pain, typically starts suddenly and can come in waves. Understanding kidney stones is important because if they're not treated, they can lead to complications such as infections and kidney damage. There are several types of kidney stones, each with different causes and treatments. The most common type is calcium stones, usually formed from calcium oxalate, accounting for about 80% of all kidney stones. Oxalate is a natural substance found in foods like spinach and nuts. Another type is uric acid stones, which can form in people who don't drink enough fluids or who lose too much fluid, those who eat a high-protein diet, and those with gout. Struvite stones can form after a urinary tract infection and can grow quickly and become quite large, sometimes with few symptoms or little warning. Cystine stones are rare and form in people with a genetic disorder called cystinuria, which causes the kidneys to excrete too much of a specific amino acid. So, how do these stones form inside the kidneys? Kidney stones can form when there's an imbalance of substances in your urine. One of the primary causes is dehydration, which makes urine more concentrated with stone-forming minerals. A diet high in protein, sodium, and sugar can also increase the risk of some types of kidney stones. Certain medical conditions, such as urinary tract infections, kidney disorders, and metabolic disorders, can also contribute to stone formation. Genetics play a role as well. If someone in your family has had kidney stones, you are more likely to develop them. Additionally, obesity and certain digestive diseases or surgeries can affect your body's ability to absorb calcium and water, leading to the formation of stones. The most common symptom of kidney stones is severe pain, typically on one side of the back or lower abdomen. This pain can radiate to the groin area and can be accompanied by nausea, vomiting, and frequent urination. Sometimes, urine may appear pink, red, or brown due to blood. Other symptoms include cloudy or foul-smelling urine and an urgent need to urinate. If the stones causes an infection, fever and chills may occur. Diagnosing kidney stones usually involves a combination of a medical history review, physical examination, and diagnostic tests. Imaging tests such as CT scans, X-rays, or ultrasounds can help locate the stone and determine its size and shape. Urine and blood tests can reveal high levels of stone-forming substances or underlying health conditions contributing to stone formation. Early diagnosis is key to managing pain and preventing complications. Treatment options. Treatment for kidney stones varies depending on the size, type, and cause of the stone. Small stones often pass on their own with the help of drinking plenty of water to flush them out and taking pain relievers to manage discomfort. Medications like alpha blockers can also be prescribed to relax the muscles in your ureter, helping stones pass more easily. Larger stones may require more intensive treatment. Extracorporeal shockwave lithroplasy, or ESWL, is a procedure which uses sound waves to break up stones into smaller pieces that can be passed through urine. In more severe cases, surgical procedures such as ureteroscopy or percutaneous nephrolithotomy might be necessary to remove stones. Your doctor may also prescribe medications to prevent future stones, especially if you have recurring issues. Treatment aims to relieve pain, remove the stones, and prevent new ones from forming. Now, let's discuss how you can prevent developing kidney stones altogether. Preventing kidney stones involves a combination of dietary and lifestyle changes. Staying well hydrated is crucial, as drinking enough fluids helps dilute substances in the urine that form stones. Aim to drink at least 2 to 3 liters of water a day. Reducing salt intake can prevent calcium stones, as sodium increases the amount of calcium in your urine. Limiting foods high in oxalates, such as spinach, nuts, and chocolate, can help prevent calcium oxalate stones. Eating a diet low in animal protein can reduce the risk of uric acid stones. Some people may benefit from taking certain medications to prevent specific types of stones, as prescribed by their doctor. There are certain foods that increase the risk of kidney stones due to their high levels of specific substances. Let's have a look at them. Foods rich in oxalates, such as spinach, rhubarb, and nuts, can contribute to calcium oxalate stones, the most common type. High sodium intake from salty snacks and processed foods raises calcium levels in urine, promoting stone formation. Animal proteins like red meat, poultry, and seafood can lead to uric acid stones by increasing uric acid levels. Sugary beverages, especially colas with high phosphoric acid, can also be a risk. Limiting these foods and staying well hydrated can help prevent kidney stones. Potential issues. If left untreated, kidney stones can lead to several serious complications. One of the most common complications is a urinary tract infection, or UTI, which can occur if a stone obstructs the flow of urine and creates a breeding ground for bacteria. In severe cases, this can progress to a kidney infection, which requires immediate medical attention. Another potential complication is kidney damage, as the stones can cause scarring and loss of function in the affected kidney over time. Chronic kidney stones can lead to long-term kidney diseases or even kidney failure if not managed properly. Additionally, stones that remain in the urinary tract can cause persistent pain, bleeding, and inflammation. Early detection of kidney stones allows for less invasive treatments, such as increased fluid intake and medications, which can help pass the stones naturally. Detecting stones early can also prevent them from growing larger and becoming more difficult to treat. It reduces the risk of complications such as infections, kidney damage, and chronic pain. Regular medical checkups and being aware of the symptoms such as severe pain, changes in urine color, and frequent urination can help catch the condition early. If you have risk factors for kidney stones, proactive monitoring and preventative measures can significantly reduce the likelihood of developing them. Like everything else, this medical issue is also surrounded by many myths that don't have scientific backing and are untrue. So let's bust some common ones. One common myth is that only older adults get kidney stones. However, they can affect people of all ages. Another myth is that drinking cranberry juice can prevent kidney stones. While cranberry juice can help prevent UTIs, it has no proven effect on preventing kidney stones and may even increase the risk of some types of stones due to its oxalate content. Some people believe that once you have had a kidney stone, you'll always have it, but with proper preventative measures, you can reduce your risk significantly. It's also a myth that only calcium-rich foods like milk cause stones. In fact, a balanced intake of calcium is necessary for kidney health. Understanding these facts helps dismiss myths and encourages informed decisions about kidney stone prevention and treatment. When to seek medical help. You should seek immediate medical attention if you experience severe pain that you cannot manage at home, especially if the pain is accompanied by nausea, vomiting, fever, or chills. These symptoms could indicate an infection or a blockage that requires urgent care. Additionally, if you notice blood in your urine or have difficulty passing urine, it's essential to consult a healthcare provider. Persistent pain, even if it's not severe, needs to be checked by a doctor to determine the cause and appropriate treatment. If you have a history of kidney stones or are at a high risk, regular checkups with your doctor can help monitor your condition, prevent issues, and ensure you receive the best care possible. And that's it for today. If you enjoyed this video, then make sure to check out the next one shown on screen.